I am teaming up with Lancaster Cancer Center to create these little videos called Dishes to Nourish, and this month we are talking about plant-based diets in relation to cancer treatment. So plant-based diets are a really nice option to incorporate more fiber, more vegetables, more fruit, which would lead to having more vitamins and minerals into your diet. So it allows you to feel full and satisfied throughout the day. Some research is inconclusive if it is going to help with prevention of cancer or mortality rates. However, it has shown some benefit due to those fiber, mineral, and vitamin components. A plant-based diet consists of all plants. You can do different styles of that. So sometimes individuals like to still include eggs, or some people like to still use fish in their diet. So you may still add in some of those animal products, or even like dairy. Some people will still add in dairy. Another great thing, if you don't want to go full plant-based, is to incorporate maybe 1 or 2 nights a week where you make a meal without meat. It does help to save money. Usually those options are a little less expensive, and it helps just add variety. Sometimes it's hard to make sure that you're having good options with your meals and mixing it up. So some things that you can do to add more plants, especially with like protein options, you can add peas, nuts, seeds, whole grains, so things like spelt or quinoa, barley, whole grain rice, whole wheat pasta. You also could do lentils or beans. There's so many different directions you can go with adding those different protein options. You also can add soybeans or soy products such as tofu or temp. That's another great way to add in a new protein that would be plant-based versus animal-based. With full plant-based diets, there are some concerns. There are potential vitamin deficiencies. So that is something that you want to talk with your doctor about if you are going more on a plant-based diet, or a dietitian, to make sure that your levels are within normal range. But at times, your vitamin B12, which can affect your energy level, your iron, which affects your blood health, calcium, your bone health, iodine, and omega-3s, all of those can be affected when you go to more of a plant-based diet. So you may need extra supplementation, or if you are going on a full plant-based diet, it just might take some time to learn what foods to incorporate to make sure that you're getting enough of those vitamins and minerals. But usually you do need some supplementation of vitamin B12 or iron to help those levels stay up. Again, it is good to talk to a professional before you start any supplementation, especially if you are in active treatment. I hope that's helpful to give you some information about plant-based diets. If you want to learn more or have any more questions, please feel free to reach out to Lancaster Cancer Center.